Happy birthday, Healthcare Social Media Europe. I've written recently with Celia that community is a six-letter word, and Healthcare Social Media Europe, or hcsmeu as our acronym is known, has proved itself to be just that. In a sense, a hashtag is just an abstraction. But what Healthcare Social Media Europe has proven is that when people come together in the name of something that means a lot to them, then things can happen. And what has happened? Well, we've had 49, it'll be 50 today, I guess, meetings on Twitter. We've had an unconference, we've come up with a declaration. What have we achieved? Thus far, I don't know. I'm not going to say that we've achieved that much other than created a space where people can talk. But I'm hoping that we can go beyond talk in our second year. In the camp at Berlin, we came up with three things that we thought we'd like to do. The first would be to create a knowledge hub. Obviously, this now exists with the Wikispaces site, but I'm conscious of the fact that we don't want to reduplicate great work that's being done elsewhere in the web by people like Bercy. So we need to define what that really means. We also said that we'd start some national chapters, and that's happening. We have Healthcare Social Media Europe in Spain, of course. We have now, I'm delighted to say, Healthcare Social Media Europe in Austria. Healthcare Social Media Europe in France is slated to come up soon, and so on. So this will cascade through our regional membership, and it's a fantastic achievement, and thank you to everyone who's doing it. And we've also said that we would like to collect, analyse and share data. Still not quite sure what that means, what it's going to look like, or what we're going to do with it. We've referred to ourselves as analysts, and I think we do have a lot to offer in terms of insight across the board. And I'm hoping that we can find regional ways of introducing the knowledge that we've discovered and what we have to share. But there's certain stuff that we're not doing very well too. We're not including the key constituencies that I'd like to see represented in Healthcare Social Media Europe. You can read on the wiki why Celia and I wanted to create it. But we just founded it, you've made it happen. You can hear my cat in the background here, hang on. This is Monty. He's kind of social in his own way, but also very loud, as anybody who's tried to have a phone call with me this year will know. We don't have enough healthcare professionals, carers, patients, patient advocacy groups, policy makers, all these voices in the health conversation which are not currently represented. Everyone who's currently in the group, I thank you for your contribution. Please carry on turning up and doing all the great stuff that you do. But if we're going to be taken seriously, I can't help but feel collectively as a means of interpreting and helping folks engage with, a terrible word, but let's use it as shorthand, the health conversation in Europe, we've got to do better in the next year. So let's see where the next year takes us. But for the meantime, thank you for everything that you've done in the last year. It's been a thrill and a pleasure and an honour to have listened to you, to have learned from you, and to have engaged with you. So to the next year, from Monty and from me, thanks.